everyone, how are you today? I hope you have a good news today. First, I will introduce myself. My name is NISRINA NUR AFIFAH. I'm from a 21-2 nursing study program. In this video, I want to tell you about health issue, and the title is The Pathophysiology of Gestational Diabetes Mellitus. Gestational diabetes mellitus (GDM) is a serious pregnancy complication, which women without previously diagnosed diabetes develop chronic hyperglycemia during pregnancy. The consequences of GDM are an increased risk of maternal cardiovascular disease, type 2 diabetes, macrosomia, and birth complications in the child. Risk factors include being overweight, westernized diet, and micronutrient deficiencies, advanced maternal age, family history of insulin resistance, and diabetes. This review will discuss what is known about the pathophysiology of GDM and what has yet to be elucidated. In order to do so, a contextual summary of glucose regulation during normal pregnancy, classification of GDM, form of GDM, risk factors for GDM, and consequences of GDM is first required. Glucose regulation during healthy pregnancy. During a healthy pregnancy, the mother's body undergoes a series of physiological changes to support the growing demands of the fetus. These include adaptations to the cardiovascular, renal, hematological, respiratory, and metabolic systems. One of the important metabolic adaptations is insulin sensitivity. During pregnancy, insulin sensitivity changes depending on the needs of the pregnancy. Gestational diabetes classification and prevalence. The American Diabetes Association (ADA) officially classifies GDM as diabetes for diagnosis in the second or third trimester of pregnancy for which there is no apparent pre-existing type 1 or type 2 diabetes. However, the exact threshold for the diagnosis of GDM depends on the criteria used, and so far there is a lack of consensus among healthcare professionals. Types of gestational diabetes. Outside of pregnancy, 3 different forms of diabetes mellitus are described: autoimmune diabetes type 1, diabetes occurring against the background of insulin resistance type 2, and diabetes as a result of other causes, including genetic mutations, exocrine diseases, pancreas. Gestational diabetes risk factors. Epidemiological studies of risk factors for GDM are limited and are usually influenced by confounding factors. In addition, inconsistencies in diagnostic criteria for GDM and risk factor measurements make it difficult to compare findings across studies. Despite these concerns, several risk factors for GDM emerged consistently. Consequences of gestational diabetes. Children born to mothers with GDM had a nearly double risk of childhood obesity when compared to non-diabetic mothers. Even after adjusting for confounding factors such as maternal BMI and impaired glucose tolerance detected at 5 years of age. Therefore, women are more likely to experience GDM in their own pregnancies, which contributes to the vicious cycle between generation of GDM. Thanks for your attention. If I have many mistakes, I apologize to you, and see you.